When you're massaging the back of the leg, the most important thing is to make sure that you've exposed enough working area. So what you really want to do is make sure, as well as there being enough oil for you to massage your client, you've exposed enough of the glutes that you can really get in there and massage the full leg area. For some people, they will feel exposed if they've never had a full body massage and it includes the leg, because quite often when you're the client on the bed, you can feel quite exposed, but the honest truth is you might feel as if almost all of your glute is exposed, but that shouldn't be the case. There is a bit of a debate about whether you should have underwear on or not when you're having a massage, but the truth is it should really be what you're comfortable with. As we've said before, we don't recommend that you wear your best underwear because there is oil involved and there's always a small chance that there could be some discoloration with oils. But what to do is discuss with your massage therapist. If they prefer that you don't wear underwear but you're still covered with a towel, then discuss whether you feel comfortable with that. But likewise, there are other therapists that have absolutely no issues with you wearing underwear, because what they'll do is they'll tuck the towel into it so that there's no way that it's affecting what you're doing, and likewise you stay comfortable. But the main thing is that we do expose the correct area. As you can see here, when we're massaging as well, we have to make sure that there is enough oil on the area. If there isn't enough oil, then we will just drag the skin. It ends up being more of an uncomfortable friction, and no one's actually comfortable then. The therapist isn't comfortable because all that's happening is that they're dragging and they can't perform the massage movements correctly. And as a client, it just doesn't feel nice, doesn't feel relaxing. But likewise, maybe not as common, but too much oil, it's just another issue, because then you can't control your massage moves because you're slipping about too much. For instance, with this kneading and the butterfly movement, if we had too much oil on, then we wouldn't be able to get a firm grasp on the skin. Your hands would just be sliding all over the place. It's not effective for you doing your treatment. It's also not effective for the client. So it's all about getting these things correct before you start. As you know, with these chats, it's more about telling you basically in real time, not necessarily what we're doing, but maybe some hints and tips for the therapists, but also for the client, how we do understand how you're feeling. So if you do want to know more about the specific movements, then you can check the other videos within the channel. I think it's quite important to point out to you that we're actually not judging you. A lot of people say to you, "Oh, I'm really sorry, I've not had a chance to shave my legs," or "Oh, please don't, I hope you don't notice that bruise." A lot of times you'll find that clients are full of apologies before you've even started the massage. There's another one sometimes, "Oh, I'm sorry, I've not had a chance to tan." There's so many reasons why we feel quite sort of underconfident as clients when we're going in for a massage. It's as if we think we're going to get judged. Just want to tell you that any professional massage therapist is not interested in whether you've shaved or waxed your legs. We're not there to judge you on whether you've got bruises. Obviously, if something's happened and you've got a massive bruise on your leg, we're going to have to treat that as either a contraindication or a special care requirement. So we might ask you how it happened. We might have to avoid it. If it was a really bad bruise, maybe you'd fell, really hurt yourself, we might have to postpone your treatment. But we are not judging you. So when you go to the doctor and when you go to any reputable therapist, please don't worry yourself about whether you feel that your legs are ready and suitable for us. We are there to make you feel better. So I really wanted to share that with you, because still to this day, after well over a decade in the industry, there are still people that will say, "Oh, I hope you don't mind, but I've not had a chance to do this or that." We just want you to enjoy the treatment. So again, looking back at where we are within the treatment, we've warmed up the tissues and we're now doing a lot of our more strenuous movements. When you're having a massage, when there's any hacking or cupping here, remember as the therapist that you should be checking to see if your client is jumping or jerky. These could be little hints that maybe your pressure might be a bit too heavy. Maybe you are not as loose in your wrists as you should be. What you really don't want to see is somebody flinching or maybe even their shoulders rise. These are all little hints that maybe you're your pressure, your movements are not quite right. Sometimes people are too polite and they won't say to you that it's painful, but it's up to you, if they're not telling you what you think is the truth, to maybe work on your analysis and see if maybe you're being a little bit more heavy handed than you think. Likewise, though, sometimes people are way too soft with any of their more strenuous moves, and if it's too soft, it can be just irritating to your client, and it's actually not as relaxing or effective as it's meant to be. But as you can see here, it was just out of the video, you couldn't quite see it, but when you are moving from side to side when you're doing the massage treatment, you want to try and maintain contact at all times. So depending on which way you walk around the massage table, if you can't hold on to the area that you're massaging, then try your best to sort of maintain contact as you're walking around, so maybe your hand will slide up to the shoulders. It just keeps your client safe and secure, and it also prevents them getting a fright if you drop contact and then all of a sudden you appear a few seconds later and it's quite an intense movement. So just to keep them relaxed, because sometimes they're actually relaxed and sort of, sometimes they do fall asleep, sometimes it's just more of a sort of semi-consciousness. They're still in the room but they're very, very relaxed, and what you don't want to do is give them a fright. But what you can see that we're doing here is working on the calf, also known as gastrocnemius. This is a lovely area to be massaged because many of us don't realise how much tension we hold in that area. So again, when you're working on that though, as a therapist, really make sure that your pressure is just right. If your client is feeling chatty and they want to talk, then it's a great time to ask them if the pressure's okay for them. If anyone's quite into their exercise, they run and they keep themselves fit, then you'll really feel the difference here in tightness, and it can be good if they are alert and want to talk, just to say to them, does this feel quite tender, is it quite sore? Because as you know, muscles will hold the lactic acid, and we can tell a lot if there's any knots and nodules, but the number one person who can give you the most response is the person that's having the massage done. Again, with some people, you might want to omit the heavier movements. It really does depend on what their situation is and what your consultation led you to decide to do. But just because we're doing a real-time back of the leg here, it doesn't mean that you have to do every movement. And we've said before, just because you're taught a routine does not mean that you have to follow the exact routine. Be guided holistically by your client. If you feel that they need a little bit more time in a certain area, a little bit more of kneading, a little bit more effleurage, then be guided by that. It's not ideal if all you do is follow your routine from step 1 to step 10 and you were just following the numbers and you weren't really connecting with your client. The main thing in these videos is really to let you have confidence in yourself as a therapist and as a client, to understand that we've got your top priorities at heart.